Let's officially get started with our webinar. We will have no slides. This is a roundtable discussion. So if you're wondering where the slides are, you get to look at 4 people on screen and hear from our expert panelists. But today's topic is Disinfection Decoded, with a teaser subtitle of Exploring the Evolution and Importance of Surface Disinfection and Compatibility. So you think about this topic today, Disinfection Decoded. We're going to dig into what that means for cleaning, for disinfecting and facilities, and what all on our webinar today can do to get the most out of this topic for their work. And I do see someone from Nigeria. Emmanuel, nice to have you. I think I've seen you before. So we have some international people here as well, Ben, Jennifer, and Alice. So I'll introduce our presenters today, and we have a series of questions we're going to present to them, topic questions. And then if you'd like to ask questions in the chat, they're going to keep an eye on that as well. So if you have a question as they're speaking, put it in the chat. You can do it to just the panelists, to everyone. We will keep an eye on that and make sure we address everyone's questions and concerns. If we have time at the end of our session, we'll also do a Q&A. We'll see how things go. We will probably cover a lot of the questions you have with the presentation. But today with us, our expert panelists, we have Jennifer Picker, National Accounts Manager for EVS at PDI. Jennifer, we're pleased to have you with us today. Alice Brewer, Senior Director of Clinical Affairs with PDI, and Ben Dolcimascolo, Director of Marketing at PDI. Welcome, everyone.
Thank you, Jeff.
Thanks, Jeff.
Going to be a good webinar. So we're going to go around and talk about some of these points. And with your first question, they'll ask, feel free to share what you do at PDI if you'd like to, and also maybe add in why this is such an important topic. So the first point we're going to look at, here's the question, here's the point. We've all heard a lot lately about the importance of cleaning before disinfecting. Can you explain why that is so important and what the proper cleaning and disinfecting process should be? And Jennifer, we're going to start with you on this. You're on the hot seat now.
Well, thank you, Jeff. So I'm Jennifer Picker. I work on our national accounts team. I focus on EVS, EMS, really surface disinfection. So this is a great question. Why is cleaning so important before disinfection? Well, let's start with kind of the proper way to clean and disinfect. Every different management company or EVS company is going to have a bunch of different standards or protocols that they use. Well, they're all different. So the Association of the Healthcare Environment, or AHE, has really come down to 4 main concepts that we can kind of follow to keep that up. So the first one is going to be the most important. You clean from the cleanest surface to the dirtiest surface. So clean first, and then move to the dirtier surfaces so you're not cross-contaminating. You're going to want to start at the top down. So cleaning something above before you clean something below is going to be really important. And we think of gravity. So you don't want to clean a table below and then clean a ceiling fan where you're going to have dust fall onto that clean surface below. So top to bottom. And then you want to go in the same kind of direction. So unidirectional. So if you always start on the right side of the room, you always start on the right side of the room. So you make sure that you never miss a spot. And then you want to do it in the unidirectional way. So one swipe, and then you want to do another swipe on the surface, just overlapping, going in the same direction, so that you make sure that you get that entire piece of furniture, table, whatever it is that you are trying to disinfect. Well, the way that I used to present it to my staff really goes, okay, we want to do the big things first. So if we're doing the cleaning part, let's do the big stuff. So on a macro level, you want to get out the trash. You want to get out the linen. You want to get out any organic material that might be sitting there so that you can clean that step. So then when you go to the micro step, that's the disinfection step. So then we're getting rid of all those microorganisms. So start big and then go small. And the reason you want to do that and you want to clean before you disinfect, I have a little analogy. So imagine having a shirt on, you put your sunscreen on. Well, you're protected until that shirt moves a little bit and now your skin is exposed to that sun. So the same thing with cleaning. You want to clean first so that when you do that disinfection step, you always hit all the areas that you need to hit and you don't miss anything. Hopefully that describes it, but I'll pass it to anyone else that wants to jump in.
I think that's good information and a good analogy as well. So we're going to move next to Alice.
Yeah,
Share your thoughts and a little bit about yourself if you'd like.
yeah. So as Jeff said, I'm the Senior Director of Clinical Affairs at PDI. So I'm an infection preventionist and an infectious disease epidemiologist. And so I head up all of our clinical activities. We have a team of, infection preventionists here at PDI, and we, can help with education and answering customer questions and research and really helping to understand, how we can best support customers in supporting their patients and their organizations. So I love talking about cleaning and disinfecting because that's really sort of the foundation of preventing infections. So, Jennifer's right. You have to clean first. If you don't, whatever disinfectant you're applying is just not going to be as effective. So in healthcare, just kind of the nature of the environment is that you're going to have a variety of bodily fluids or soil or solutions that are being used in the care of the patient are going to be covering surfaces. And if you don't take those off first, then those disinfectants can't get to the organisms that are on the surfaces to kill them. So that's why, we clean first, we remove anything visible off the surface, and then we disinfect. And if we don't do that, it's a little scary to think about how long those organisms might be lurking on surfaces if we don't properly clean and disinfect. So, for example, C. diff can stick around on a surface for around 5 months. MRSA can be on a surface for up to 7 months, and E. coli can stick around for up to 16 months if we're not really removing it from those surfaces. So, very important to make sure that we're, giving those disinfectants the best kind of opportunity to disinfect. And you will see sometimes there are products that are both cleaners and disinfectants, but you really have to carefully read that product label to understand if that's the case, if they really are intended for both. And then that label will also give you the proper instructions for use to make sure you really are cleaning and disinfecting. Sometimes it's just a marketing ploy to say that it's a one-step product, and it may not actually be.
And that can be very enticing because that means saving time, saving money.
Absolutely. And we all want to save time and money, but saving time and money in the short term is not going to benefit us in the long term if we're allowing some of these organisms to remain on surfaces and cause a risk to our patients.
And you mentioned one will last 16 months on a surface. 16?
Yep.
That's
E.
a crazy
coli is
number.
really stubborn. And so if you're not, really allowing that disinfectant to get to it, then it's not going away.
Okay. Ben, I don't know. Can you add more to this and introduce yourself as well?
So Ben Dolcimascolo, I've been at PDI for about 8 years now. So what I'm looking forward to having a conversation about is I've had the opportunity over the 8 years I've been with PDI just to understand a little bit more about some of the pain points that a lot of the customers are experiencing, from staffing shortages to training education. I know we have a couple of questions kind of talking about that, but as I listen to Alice and Jennifer, not too much to add there. Just want to say, I do think no matter how we clean, it's important, especially, across all care settings, that we do it the same way consistently. And I think that goes back to how do we better train our staff? How do we educate them? What's the consistency that we have amongst workers? I know when I go to hospitals and I survey hospitals and look at what they're doing, and it's very hard to do this. Some units are more consistent as far as how they train and educate than others, right? So it's how do we collaborate better across all different types of settings? How do we educate and train our staff? And most importantly, we're going to talk about this too. How do we keep people motivated and engaged as far as how they actually clean and make sure that they understand that what they're doing is actually a huge important aspect of preventing infections. So I'm excited for the conversation today, and I think Jennifer and Alice covered the question fairly well.
Very good. I just noticed that everyone took my put in the chat your question seriously comment. So so you three, if you want to keep an eye on that and address any of those as we talk, that would be fantastic. We have already like 3 or 4 really good questions there. So feel free to engage those in your comments. And any that we don't cover, we'll try to cover at the end. And we will have this information to follow up on after the webinar as well. So that could happen with some of the questions. But point number 2 is this, and Alice, we'll start with you on this. COVID taught the world all about the need for PPE and surface disinfection. Since then, many organizations are setting a standard that hospitals must be prepared for emerging pathogens. So, can you tell us more about how we can prepare our facilities for what is to come next?
Yeah, so you're right. It definitely shone a light on our preparedness efforts, and now it seems like there's a new emerging pathogen that pops up every few months. So we're certainly getting to exercise those muscles now that we brought out during COVID. So there are a lot of resources out there that can help and make sure you have some tools and information you need. I would start with the EPA. They have an emerging viral pathogen claim that can be applied to products that have met specific criteria. And so we know that they'll be effective against any new viruses that have popped up, but that we haven't yet had a chance to test against. So monkeypox is an example. That one's really still fairly new. A lot of products haven't had an opportunity to conduct the testing for it, but that emerging viral pathogen claim allows us to, say that these certain products will be effective against it. So the first thing I would say is check and see if you've got any products that you're currently using that have that claim. Make sure your team knows what they are and how you use them. And if you don't, then figure out how you can get yourself some. The EPA maintains a list of those products. It's called List Q. You can find it on their website. You can just Google EPA List Q. And it's great because it provides a list of the products with that claim, but it also provides you information on the contact time that you need to use with that product and which label instructions to follow, because sometimes you have different contact times for different organisms. So that's a great resource and a way to know if you've got a product that you can use on something that is an emerging concern. I also, and this is something I say about lots of things, this is a common piece of advice I give, is to make sure that you have a really solid line of communication between infection prevention and environmental services. Both departments are going to be getting different but complementary information and have complementary tools and resources available. So lean on your partners in that cleaning and disinfection space. For example, I know that FAPIC, which is the Association of Professionals in Infection Control, has a great and very comprehensive toolkit that can help prepare for an emerging pathogen outbreak. Kind of goes through what kind of things do you need to have, what kinds of things do you need to be thinking about, are there intake questions you need to be asking, how do you partner with EVS? So lean on your resources that you have internally to make sure that you are prepared for whatever the next thing is.
Shared a lot of good information, and one point was one of our questions we received as part of registration, and that was how long to allow products to dwell on surfaces. So thank you for clearing that up, because yeah, it's on the label, isn't it? It's in the directions. Mm-hmm.
Yes, it's always on the label, and sometimes labels are really hard to read, and we aren't often trained on how to read them, so that can certainly be a challenge sometimes. But the label for the product should have all of the information you need, and if you ever are struggling with that, your internal infection prevention team can probably help you with that, but also the product manufacturer should have that information for you.
Good information. And Ben, I have some good news for you. You're not going to go last in this series, so go ahead and share your thoughts.
No, just to kind of react off of Alice's response there. I do think we're talking a lot about emerging viral pathogens here, but I think it's important to understand a couple of things have changed pretty considerably since the pandemic. And I think one of those things is just looking at different high touch services and doing a risk assessment as far as what different pieces of either devices or, commonly touched services such as light switches, more common areas and waiting rooms, those areas that are higher risk, I think are really important to getting back to the basics as far as how to prevent something from spreading across all types of facilities. The other piece I wanted to mention too, and as I'm thinking through this question a little bit more, I think supply surety is something we have to talk about as an industry. I know the pandemic definitely shifted the way us as suppliers think about making sure we're sourcing raw materials and that we have, extra headspace available on our production lines so we can accommodate, any sort of changes in the market. It's a question I want to encourage more people to kind of have an open dialogue with their supplier. I could speak on behalf of PDI in general. We've had a lot of transparent conversations around how we handled, allocations during the pandemic. And again, if we have any sort of, not to speak for the future here, but we have any sort of future pandemic or any sort of emerging pathogens that might, cause a spike in the number of wipes that are used, we want to basically have transparent conversations with our customers about how we can guarantee service levels to them, What's our turnaround time? We work really closely with our distributor partners. So when you are evaluating products, and I know we're going to talk about this in a little bit of the later conversations, I think that supply surety conversation is a really important piece to kind of have. And the last thing I will say, and this is, again, I'm going to talk about this a little bit later in some of the new innovative technologies, data monitoring and surveillance, I think, is going to be a big piece of how we get smarter, especially during some of these, outbreaks that we can see. Identifying outbreaks early, identifying how we handle them, what some of the best practices are. I think just sharing that knowledge through the data and making sure it's shared in real time is going to be a big component of as far as how we accurately and efficiently address some of these things that come up in the future.
Thank you, Ben. And Jennifer, last but not least, go ahead.
Well, let's say from like an EVS point of view, really, I think if we're thinking about EVS, we have to think about the communication with the staff. I know that they get very nervous. They don't have that, epidemiology background, so they might not understand what these emerging pathogens are. So having a plan, being able to communicate with your staff, making sure that they're not nervous anymore, that they know we have products on hand that we can use for these emerging pathogens. And then just making sure as a management team, you're doing your research as well. You're reaching out to your infection preventionists, or, you're going on to the CDC's website, EPA's website, and doing your own research so that you can then help your staff kind of get through that and understand, there might be some process changes. We saw that with Ebola. We had to do some process changes. So, there might be stuff like that you have to maybe practice with your team on, okay, if we have to don and doff something different than we're used to, let's practice that so that when the time comes, we can do it right away and we're not going to be missing anything. So just the preparedness and the communication, I think, is going to be really important.
Thank you. And since you went last that time, this next question, you can go first. So our third point, unless there's more to add to this, we'll move on. Okay. What are facilities looking for when it comes to picking products and devices to support their disinfection needs? And how have these disinfection practices changed over the years? Jennifer?
Okay, well, I think it's kind of the same. So the way that it's changed, I think, is in the product selection process. In the last, 4 months, I have seen more and more EVS directors reaching out, just wanting to know more about what products are out there. They are looking more for something that's going to be fast, that's going to be broad spectrum. So they're looking for multiple organisms at a faster time. I'm seeing a lot of facilities looking for SKU reduction. So maybe going with one manufacturer and multiple SKUs under there. They're looking for compatibility. And really, I'm not just seeing this in healthcare. So we're kind of seeing this across the board. We're seeing it in education. We're seeing it in food and beverage. Just next Tuesday, CNE Professional has an ISSA webinar, right? Just like this one. And they're going to be talking about that as well. So go into that one if you're in food and beverage and you want to learn about CNE Professional, because they're going to be having that. And we see both industries really looking at the product selection as, what can we do better for our customers, our patients, our veterans? What can we do to make sure that we're saving money and giving the best product out there?
Very good. And Alice, if you could answer, but someone did ask about the pathogen that was 16 months. I mean, that's got everyone's attention.
So E. coli can survive on surfaces for up to 16 months if you're not thoroughly removing it.
Okay, thank you for answering that.
Yeah.
Before you comment, Alice, Jennifer mentioned next week's webinar as well. The link for the event is now in the chat for those that would like to also join that one who are here today. So again, another group of experts will be there. But Alice, sorry to take away your thunder. Why don't you talk to us about that third point?
No, I was actually going to let Ben take the lead on this one, because I know when we were talking about this one, he had some thoughts around this one. And, Jen really, covers it from, the acute care infection prevention standpoint.
Sounds good.
As well.
Ben? All yours.
Sorry, I got too much to say on this one. So, I have a couple thoughts. So I think what Jennifer said, she covered it well. There's kind of like 3 different pillars that people look at when they're assessing different products to bring in. The first is ease of use, so making sure it integrates into workflows seamlessly. I think that's a big piece of it, especially when you have some issues you're dealing with as far as new staff coming in. How quickly can they adopt? the workflow, if they're mixing and diluting things versus using a pre-saturated product, there's some efficiencies they can realize with having certain disinfectants that they're selecting. The other piece I wanted to talk about, and Jennifer did hit on this, is compatibility. And it's a little bit of a passion of mine. I do think, at least in the healthcare space, a lot of people are talking about how compatibility is impacting their day-to-day jobs. One of the things that we have to think about from a healthcare focused perspective is a Joint Commission is crunching down on making sure that from a hospital perspective that you're using the proper disinfectants that are listed on these device IFUs. And the challenge that creates for a lot of infection preventionists in the healthcare setting is that there's not one disinfectant that's out there that's on every single device IFU. So right there, you have a problem, because a lot of these Joint Commission auditors, when they come in, they'll focus on a lot of the patient interfacing devices, glucometers, looking at blood meters and things like that, things that are typically used and are actually interacting with a patient. So what we're doing, and I think what the industry as a whole is doing, is trying to partner with these OEMs or these equipment manufacturers who put together these IFUs and make sure they try to list it by formulation and go away from a little bit of naming certain devices or certain disinfectants that you can use. But also working with facilities when they have these Joint Commission audits upcoming and making sure that we have a gap analysis we can help them with. So if they're looking across their hospital, it might be 2,000 plus devices they have. We can help them actually through a database look at, hey, there's certain devices that you might have a gap, meaning that your disinfectant of choice is this, but this IFU is saying something totally different. So it's a really important topic. And unfortunately, I think because of some of the things that are happening with the Joint Commission, it's going to be something that more infection preventionists have to deal with. But even outside of that, I think as all markets, you look at education, some of just the regular facilities teams, you never want to use a disinfectant that's going to break down or degrade your materials that you use it on, like tables, things like that, that from an aesthetic perspective, it could yellow plastics, it could, break things down, it can cause corrosion. So what we're trying to do, again, is be as transparent as possible from a supplier perspective and do a little bit of our own testing on different materials and provide that testing to the general public. So when they're trying to make an assessment on, hey, I'm going to bring in this disinfectant, how does it behave on all these different materials? We can give them some general guidance and show pictures. We have constant strain testing we can do to kind of replicate how the actual disinfectant does over a long period of time. Because when you bring in a disinfectant, of course, it's going to look fine, a week or two from now if you keep on wiping it down. But really what you have to pay attention to is how is it going to look a year or two from now when you keep on wiping that surface daily. And we all know since the pandemic, a lot of what's happened is the amount of utilization of wipes and different disinfectants has increased even more. So people are wiping down surfaces a lot more. And what that really equates to is obviously we're trying to prevent infections, but we want to make sure we're not cracking surfaces and harboring bacteria in those cracks. There's a lot of negative impact that you could have if you actually break down the material from a disinfectant perspective. So a whole lot of conversation around that I have a lot of passion for, but I think it's a topic that's going to be more and more prevalent, especially in the healthcare space, because of some of the new guidance that's been coming down. And the last piece I'll say, and not to talk too much on this, but I do think from a tracking perspective, I mentioned, looking at compliance and utilization. I think it's important that you assess kind of where you're putting these products in your facility that they get best used, right? When we're talking about EVS, the EVS team is going to come in and do a whole room disinfection. But how do you, and a lot of this has been talked in the healthcare setting, how do you get patients to be more engaged in preventing infections, right? How can you educate them about what disinfectants are being used, why they're being used? I think that goes back to the overall patient experience. And even if you look at markets outside of healthcare, how do you, inform people when they're going into a facility, hey, we're giving these products to you, or you're going to use these products and to help really prevent infections and do and help with the job that a lot of our staff is trying to solve for, right? I think that it becomes even a bigger point when you have teams of people that we used to be able to employ a lot more people doing these jobs, but now you have obviously a lot of turnover, staffing, there's challenges of getting new people, to do the job. So I think as you have less people to help disinfect, engaging, whether it be, again, your patients or people that are coming to facilities, I think that's going to be even more of a trend that we see in the future.
Ben, good information. Thank you for that. Before we move to our next point, Alice, anything to add to that?
No, I mean, I think
Okay.
Ben mentioned, the corrosion and the damage. And, that's one thing that I used to always round on in the hospital, was looking for damaged surfaces. because we know then that those are impossible more or less to disinfect because we just can't see, we can't get into all of those little micro cracks and damaged parts of the surface where organisms can be. So I think that that's hugely important because we can't afford to be replacing things all the time. And we also can't afford for them to be harboring these organisms that can pose a risk. So that's of massive importance, I think, making sure that we're not damaging surfaces.
Before we move on to question, our fourth point, Ben, we've had some questions in the chat
Yeah, I
about
saw that.
soft surfaces. Is that something we should talk about, or is that
So-
another?
Well, just this might be an answer to address a lot of the questions. I see some people are talking about different beds and mattresses. There has been, a lot of issues with soft surface. So I want to make a plug. We do have a tool that at least PDI provides the customers, and we can put that link or somewhere in the chat. And it's a database that we put together, and it goes through all these different IFUs, and you can actually select your device, such as a Stryker bed, and you can see what disinfectants are actually approved per the IFU. And then also, like I mentioned, we try to be transparent as possible, providing pictures, and generally we have a chart that shows how our different disinfectants behave on different types of surfaces. So again, that's maybe something we can provide, a link to just to share with the broader audience. But I think not just PDI, I think a lot of, as an industry, a lot of suppliers are trying to be more transparent around disinfectants and how they behave on different materials and different devices. So hopefully that answers the question.
Appreciate that. Yeah, from the questions we're getting, this group wants to know what they really need to do. So it's great to see the engagement there, the search for products and equipment. So keep an eye on that, our panelists, if you would. And let's move to our next point, and it's about staffing. Staffing continues to be a challenge across the market. What can be done to help improve training and compliance with disinfection processes? And Jennifer, we're back to you.
Well, I think the first thing we have to remember is when we're hiring people, not all of them are coming from a healthcare setting. So a really thorough onboarding is going to make a huge difference in the employees' lives, making sure that they really understand what they're getting into when they walk into a healthcare facility or even an educational facility. When they're trying to go in there and they're trying to protect whoever's going to be in there next by disinfecting, they really need to go through that onboarding and then the constant education. I think something that we've done poorly in the past is kind of one size fits all for training. So lately we've seen a lot of e-learnings and a lot of people doing a lot of hands-on. And I think that's going to kind of push the training education forward. And that will help with turnover. If more people are trained, they feel more comfortable with their position and they will stay in it longer. And then a good thing is it's EVS week. So happy EVS week, everybody. Recognition. I mean, we want to recognize our staff, not just on EVS week, but throughout the year, letting them know that they do a great job, that they have one of the hardest jobs in the industry, and they're there to help everybody else. So making sure that we're recognizing them and that we're doing incentive programs for them, that's going to be a great thing. And for everyone out there, we are doing a PDI luncheon giveaway for your EVS team. So if you want to go onto our website and you can enter your team in to win, we have till the end of the week. So till the 14th, it is open. So just a little plug for that there.
You mean like free food?
Like free food. Mm-hmm.
We need that link in the chat. So if someone could do that, there we go. Kelly Long, thank you for that. I mean, that's pretty cool. Good for you for doing that. Yeah, EVS week. What a nice way to recognize our professionals. I think now we're going to Alice on this. So what would you add to that?
Well, and I'll just echo what Jennifer said. I always loved working with my EVS teams in the hospital, and I would tell them all the time, like, I can't do my job and my team can't do their job if you guys are not doing your job. And so, completely underappreciated, but so critical to, the health and safety of everybody within the healthcare system. So we love celebrating them. But as far as kind of helping with staffing and how do we do more with less? Because we certainly are, facing a serious staffing and labor issue in healthcare and in EVS especially. So one of the things I found the biggest time saver and a huge help to maintaining compliance is standardization. And it's a word that gets used a lot, but I think it's because it really becomes important. And that can be standardization across units, across floors, buildings, systems. And it can apply to products, processes, procedures, protocols. Essentially, if everybody is doing the same thing and using the same tools, we're really able to cut down on the amount of education that we need, on the cross training that we have to do. We cut down on the number of compliance gaps that we see. So, if we can make sure that we're kind of using the same stuff in the same way across the board, that helps a lot in terms of improving compliance and saving time. And it's sometimes an unpopular opinion, but I believe in being survey ready all the time. Not just when a surveyor or a regulator is likely to show up. So, we tend to get in this mode where we know when we're in our window for a joint commission or a D&B or a CMS survey, and we're like running around like crazy trying to make sure we have everything, cleaned up and ready. But if you're consistently auditing process and protocols, consistently providing that real-time feedback and just-in-time training if you need it, you're far less likely to have a major compliance gap that then surprises you when you least expect it or want it. And it also gives you, an opportunity to find out if there are unknown or unidentified problems with products or the way your team is working or using things. And it gives you a chance to fix them before it becomes a bigger problem. And, feedback should go both ways. So we're constantly kind of giving feedback to our teams as we see, things that are popping up, but we should be open to kind of receiving that feedback as well in terms of, well, this process doesn't really work and here's why. That kind of gives us an opportunity to make adjustments and make sure that when we really need things to be working well, we're all buttoned up and everything's running smoothly.
Thank you, Alice. And before we go to Ben to wrap up this point, I want to say Daryl Hicks wins longest chat ever. I know, Daryl. Thank you, Daryl, for adding that in there. So, Ben, what would you say to this topic? Training,
Yeah.
We're hiring new people all the time. They need training.
I think Alice and Jennifer covered it fairly well. I will put an exclamation point on what both said. I think culture has to be at the forefront of how you lead a successful team. And that goes in any job, right? I've had the opportunity to be part of some really high-performing teams and now lead a high-performing team. And I think making sure people are at the forefront of this, celebrating small wins, even if they're small, tying them to a bigger mission, especially in the healthcare setting, it's really easy to get them tied to, hey, celebrating successes. And again, that goes back to Alice's point as far as making sure EVS and IP are working hand in hand. If we've been X number of days without an infection, those are things that we really should be celebrating and making sure that we're taking care of the people who are doing the job. And let's be honest, a lot of these jobs as far as cleaning are not the most glamorous jobs. So just think motivation and making sure that we appreciate the people who are doing this. And again, making sure they're getting appreciation from everybody in the facility is really an important piece of it. So that's just something to put emphasis on overall.
I like that, Ben. And you said this industry may not all be glamorous, but I can think of a lot of professional jobs that have very unglamorous procedures they have to engage in. It's just the job has to be done, but think about the end result, the goal of protecting public health. That's so important. But Ben, we're going to stick with you on this. And this last point is just a nice broad stroke. We think about how important this is. As needs continue to change, can you provide any insight into what is next when it comes to cleaning and disinfecting? And get out your crystal ball.
Yeah. So this could be a really lengthy topic. I guess I'll start off by saying that there's obviously a lot of new novel technologies that have been coming out. If you go to any trade show, there's always something new that's being pitched. What I think we have to do, and this is kind of the lens that I've been looking at new technologies through, it has to meet an unmet need from a customer perspective, right? Just because you're innovating for the sake of innovation is not a reason to have a product out there. So when I look at some of the unmet needs as far as what's popping up in the service disinfection space, and I think there's kind of some different categories, and I'll try to break it down this way. So the first, I think we're doing a lot around data-driven cleaning, and I'll go into some of the areas of opportunity there. Sustainability is obviously a big push, and rightly so. I think on the West Coast, they've adopted a little bit of a proactive approach to looking at sustainability and disinfectants. I think that's going to spread across the country, and I'll talk a little bit about some of the technologies there. Whole room disinfection, I think we talk about the layered approach at PDI. And it's really important we look at not just surface disinfection, but whole room disinfection and how we can help, look at technologies to help improve that. And then the last thing I'll say is from a compatibility perspective, we're doing a lot of work internally, and during our design process, we're doing a lot of work evaluating disinfectants, not just for their efficacy, but also how they behave on different materials. So I'll go back, and I don't want to take too long on this. I'll just put some bullet points together as far as what I'm thinking about. But for the smart and data-driven cleaning, Internet of Things, or IoT, has been a big topic, right? So a lot of companies are looking at how we can put smart technology in devices that we use every day. Pretty much everything, if you're familiar with your home automation, light switches, toothbrushes, everything is Bluetooth and smart, right? So how do we take that technology and kind of start integrating it into compliance and looking at what we're using? I'd be interested to look, and by the way, Jeff, I'm a super data nerd, so I love this question, by the way. From my perspective, I think looking unit by unit for hospitals, where the products are being used, how often they're being used, where we locate products, that's a huge area of opportunity. Because from my perspective, you can have the best product in the world, but if you don't get it in the hands of somebody who's going to be using it and the right people, it's going to fail, right? So you can have, again, the best product, the best, most efficacious formulation. If it's not in the right place and utilization is not there, you're not going to get the results you want. So I think it's a big piece in how we innovate from a results-oriented culture away from just, hey, we're selling widgets that, might do certain things, right? So that's an opportunity. There's a lot of surveillance monitoring out there. People have mixed opinions on whether it's a good thing or bad thing. I'm not sure, quite frankly, how I feel about some of the surveillance technologies, but I do think from the next generation of how do we look at ATP testing? So how do we measure microbial loads on different surfaces? Can we get smarter about that as far as not just high touch areas, but what really are the most critical points to disinfect in all different types of settings, right? I think that's a huge area for us. And then, like I mentioned earlier in my previous question, I think looking at, when we have these emerging pathogens break out, how can we get more real time? We're in the digital age of social media. How can we be more real time as far as how do we share knowledge across the globe from facility to facility? Like, there should be benchmark facilities that are really on the up and up as far as their best practices, but our goal should be to take those examples and share them more broadly. And I think in the age of technology where we can share information in real time, I just think there's better platforms we could use to kind of do that. So I'm excited for that. Sustainability, and again, I'll try to cruise to this as fast as I can. There's a lot of focus on cleaner formulations, less ingredients. Obviously patient and staff safety are at the foremost importance. So we want to make sure we're doing that from a development perspective. Sustainable packaging, so making sure less plastic in landfills, I think that's important. And then obviously from a manufacturer perspective, I think there's a huge focus on us, and there should be, to how do we manufacture things in a more green way. And I think in the past, there's been a lot of focus from a bid perspective on these GPO agreements in healthcare to take that as a point of consideration when people are selecting what products are on contract. They're looking at not just the product itself, but what's the environmental impact of the product. Whole room disinfection, I think there's been a couple questions about that in the room. UVC has been a really saturated market. PDI is involved in that market space, and I think we have a good product with some of the improved cycle times, and it's been proven. I think there's going to be a 2.0 kind of version of that, looking at some of the future UVC technologies that are out there. So I'm excited to see what that's going to bring. Persistence. So looking at surface disinfection and how we can measure persistence or design products that have antimicrobial properties. That's always been something that's been interesting for me in this organization. So I think there's a lot of innovative technologies, just making sure that we can pair them and put them into a product that makes sense and make sure it performs the way we want to. And then the last thing I'll say is there's been a lot of talk about air scrubbing and HVAC systems. That kind of goes into the whole room disinfection piece. I think it's one of the fairly newer technologies, but I'm excited to see kind of how that market evolves. And again, might be something we kind of pay attention to in the near future. And then the last thing I'll say, and it's just to wrap up, like I mentioned, from a compatibility perspective, we have to develop products that are compatible, especially because of these new guidance that's coming down, making sure products are not degrading materials, have a negative impact on the entire environment that you're disinfecting. From an industry perspective, that has to be top of mind. So it's definitely something we're paying attention to. Hopefully that was broad enough, Jeff. I know I covered a lot there, but I think that addresses some of the questions we had in the chat.
No, I think you all have been really zeroing in on the solutions that we need to hear about. So thank you for that, Ben. Very good information. And Alice, what would you add to that? Anything? And feel free to talk about any of these questions in the chat. I know There've been comments about hypochlorous and UVC.
Yeah.
So go ahead.
Yeah. You know, Ben really covered a lot of it. I think, you know, a lot of these things are, you know, as new technology comes out, I think we're always interested in, you know, what the possibilities are. As an epidemiologist, you know, like Ben, I'm a bit of a data nerd. So I'm always looking at, you know, where's the data behind these things? Because we don't want to invest in something. We don't want to bring something in to, you know, the healthcare setting if we're not sure that it's going to work, that we're not sure it's going to kill the organisms that we needed to kill and also not damage any of our surfaces or cause harm to any of the people that are using them. So that's a big piece of it. The other piece I would say is that, you know, they can be great options for, you know, some of these surfaces where we're not really sure what or how we should clean. So I know we had gotten a question earlier about floors and disinfecting floors. Always a challenge because we don't want to put something on the floor that's going to damage the finish and then we have to replace the floor. So something like, you know, whole room disinfection, UV, can be a great option for making sure that we're disinfecting that surface without damaging it. You know, we do get a lot of questions about hypochlorous acid. I've been staying very close to that and trying to understand its utility. You know, I think we are watching it because it's new and it's inexpensive and it can be a great option, but there is still this requirement that we have to use EPA registered disinfectants in patient care areas. So we have to make sure that if we're bringing something in, we're following the guidelines. We're not, you know, just stepping outside of our regulatory rules just because it's quick and easy and cheap. So, you know, with all of these things, I think we really just have to pay attention to the data and the information as it comes in because things change really quickly. And so, you know, staying on top of it can be a challenge, but that's the best way to make sure that we're using the right things in the right places.
Good points. And thank you for covering some of those chat questions as well. And Jennifer, all yours.
Yeah. So what I want to add is, you know, we say what's coming next, but PDI just put out TruDIQ. And so that does show us that we're moving forward with our technologies. You know, they have dynamic dosing and flux acceleration on there. And then we talk about data. The robust Smart Hub collects so much data. It's anything a manager would want to know about their UVC program is all in that Smart Hub, in that portal. So it all has that data. So all that data that we've been talking about, we already have it with the TruDIQ system. So if you're looking for something that way, with that robust data, you know, that is something new that came out that we're really looking at and we're improving day to day. So that's one great thing already. And then we are one company. So we have Sani Professional, our food and beverage, Trudy, and PDI Healthcare. So we're all one company. We all work together to find those great things. What's next? What's coming? How do we all work together to provide our customers with what's needed for what's next?
Very good. We are at the end of our normal topics that we were going to cover. So want to do a couple more questions?
Sure.
And Jennifer, you kind of started on this. What is PDI doing to balance effective cleaning and disinfecting with sustainability and eco-friendly products in order to be environmentally conscious? That topic is on everyone's mind. Saving the environment, but doing the job as well. Any thoughts there?
Yeah, I mean, obviously with the UVC, that's something that you're not having waste products coming out of it. So UVC is a great enhanced disinfection piece that we can use. But really, I'm going to pass this one over to Ben because I think this is something that Ben really can speak to.
We call this the hot potato session.
So I think, listen, you know, I've been to a couple of sustainability conferences. Kaiser as a health system on the West Coast is really, and I'm really glad they're doing this. They're putting together like a panel discussions on, you know, from an industry perspective, how should we be holding ourselves accountable? And also from a healthcare perspective, how do they look at all these different disposable technologies that they're using in healthcare? And there is a benefit, by the way, to use disposable technology. So I'm not saying, I'm not an advocate for getting rid of anything that's disposable, but what's the overall impact? And I think the first thing we have to do is just set clear benchmarks. And I'm gonna say it again, data is a friend here, right? If you have a goal of just being more environmentally friendly and impactful, you really can't have a goal without having a starting point. So I think the harmonizing thing here is, from a goal setting perspective, how do we track and measure ourselves? Is it emissions? Is it plastic reduction? What are the key buckets that we really want to focus on from a sustainability perspective? And once we have a clear idea, by the way, we're doing this internally at PDI right now, tracking and measuring from our manufacturing facilities. How do we measure the carbon footprint of how many truckloads we send to hospitals? How do we palletize truckloads in a way that has less of them going to our distributor partners? Everybody's looking at these things, but I think harmonizing around what are the key data points, what are the benchmarks, and then setting them internally as an organization, but also being in line with what's most important from a hospital perspective. How do they want to hold us accountable and themselves accountable to sustainability? I think that's where we're at right now. And it's a very interesting topic. I don't think anybody has an answer today as far as exactly what all of the different categories are, because there's so many different ways to measure environmental impact. But I think just the fact that we're having more visibility, and it's a topic that from an industry perspective, we're really holding ourselves accountable to, I think that's going to create a lot more focus and energy and efforts around it in the next couple of years. So I know it's a little bit of a way of skating the question, but I think we're still learning and evaluating how we can be more accountable and making sure we're doing things correctly from a sustainability perspective.
I think that's fair. There may not always be 100% correct answer to what the issue is, but the fact that we're trying and you're trying to figure it out and recognizing it is important. So we do have a chat question here from Kelvin. Wants to know about, is there a need to change disinfectant chemicals over a period of time, as virus might build immunity against the same disinfectant over time? You know, and as I look at that question, I think maybe with antibiotics that we take for illness, I think that plays into it. But we're talking about cleaning, disinfecting. And Alice, do you want to?
I'll take a stab at this one. So to be honest, this kind of area of study is still developing. We're not really sure what is going on or how much of a risk for this there is. But yes, I mean, we hear a lot about antimicrobial resistance. You know, we're seeing drug resistant, bacteria popping up, it seems like left and right. So it's a very, natural question. The mechanisms are going to be a little bit different in terms of, a resistance to a disinfectant versus a resistance to a drug that we're trying to use to treat. But there is some new research out around that that's trying to understand, how much resistance we might be seeing to disinfectants. So that, the short answer is I don't know, and I don't think anybody really knows, but it's an area of upcoming research. And actually, there's a paper I can try and put in the chat the link to it really quickly. That's a systematic review of kind of the research on this. So certainly something to pay attention to. And again, there's so much in this space that really requires kind of constant attention to make sure that we're always using best practice. And so that can be a challenge, but we do our best to kind of make sure that we're at least aware and we can be the experts for our customers about what they should or shouldn't be doing or be looking out for.
Mm-hmm. We have a question in the chat about antimicrobial coatings. And as I look at that question, I think about a time I was on an airplane and the tray table said it had an antimicrobial coating, like it was going to be perfectly clean and safe. I don't know. Does this make sense to you as professionals?
Yeah, I have an opinion on this. So I think there's two things from an antimicrobial coating perspective. The one thing is, can you impregnate different materials with some sort of, I'm not going to name the name of the company, but there's technologies out there that actually have like coatings that they claim that if you have any sort of reseeding of bacteria on the surface, it'll kind of have this continuous antimicrobial activity. I think that's interesting. I do want to say that from a material compatibility perspective, we've been looking at some technologies and how they interact with our formulations. I think it's just, there's an unknown aspect there as far as how our disinfectants or any disinfectant interacts with some of those coatings. How long do they last for? Again, there's probably a whole sidebar conversation we could have of that. There's a lot of interest there, but I think it's a good, interesting, next generation of technology. And I also think, and I think somebody else, I think Christopher asked the question about antimicrobial protectants that can be applied to surfaces. One of the things, again, looking at the next generation of different disinfectants, and things like that, I think we just have to be wary of kind of some of the both aesthetic components. So some of these different antimicrobial protectants actually leave films. Some of them might leave a residue behind, which again might attract some either, just different dust and things like that that can harbor bacteria. So I think that any new technology has its challenges. And I think the thought process behind antimicrobial technologies and persistence on surfaces is definitely something that should be explored. I don't think it comes without its challenges there. So it's just, we're trying to get there. I don't know if the industry as a whole is there just yet as far as finding the perfect answer. But it's something that definitely we should put some more research and thought behind. So again, hopefully that answers the question. I think it's interesting, but I think we just need to think critically about how these things perform on a day-to-day basis and how they integrate into our practices and workflow, and what overall might be some of the challenges that we get from the benefits and all that kind of stuff. So
That makes sense. Thank you for that. Do we want more information on that from Alice or Jennifer?
No, I think Ben covered it. The big
Okay.
question is, how long is it going to last? What's it going to be effective against?
Mhm.
So there's a lot of variables to think about, but it's definitely interesting technology, and I'm always in support of anything that can, kind of help keep things cleaner for longer.
Jeff, just
Yeah.
there is one thing, Jeff, just crossed my mind too, and I want to make sure we hit this point home because it's something that we've seen. I don't want people to think that these technologies are going to replace the need for physical removing and cleaning of different surfaces. I feel like as an industry, we need to make sure we're aware of that. There is a subconscious behavioral thing that, oh, this coating is living on the surface, I don't need to disinfect it as frequently. There is there's good science behind this, Alice, as you can speak to. You need to remove debris, dirt, and like we talked about, these antimicrobial coatings are kind of just to help with disinfection. They're not to replace disinfection and then using different disinfectants on surfaces. So just want to put that as an asterisk as far as how we think about some of these new technologies coming out.
Absolutely. But it's cool to see the technology and the innovation happening in the industry. So thank you for that, Ben. We have another question about ATP testing. Is that something we want to talk about?
Sure. Yeah, I mean, I answer this question a lot. So ATP testing, I mean, and it's a nice tool. I think it's most effective or useful for kind of spot checking to make sure that, we're cleaning. It's sort of an audit tool. But because it is it's a snapshot. It's telling us that something is clean in that moment. It's not telling us how, long it's going to stay clean. So, I think it's a useful tool in some instances. I never heavily rely on it because I think it has some limitations. The science behind it also, there's some research around ATP testing that, would indicate that maybe it's not telling us always exactly what we think it is. So I use it with caution, but it can certainly be a good tool to kind of provide some audit and feedback on cleaning practice.
That's
And the other
fair.
thing is it's looking at proteins. So it's not actually telling you if it's alive or dead. It's just that there's something there.
Yeah, and I think it's a good data point. To Alice's point, it shouldn't be the only data point when you're evaluating, are you cleaning a room appropriately? So as long as it's being used in conjunction with other data points, I think it's a helpful practice to take a look at.
All right. We are almost out of time, but we do want to have each of you close with a thought. What would you like to see the industry do next? Everyone here on our webinar, as they leave today, what do you want them to do? Jennifer, let's start with you.
We're going to start with me.
Sure.
Let's see, industry. I've always said 2020 has now helped us look at surface disinfection and PPE. And so I want to see us do better with the education for our EVS staff. The Association of Healthcare Environment has some classes that can be taken for our environmental service technicians. I want to see them grow, and I want to see, the industry focus on, the department that maybe hasn't been focused on a lot, and just kind of lift them up and show that they are just as important as everybody else, and keep that moving forward.
Very good. And Alice, what would you say?
So this is the advice I give a lot, but, just make sure that you're, paying attention to what best practice is. Things change really quickly. Don't feel like just because you've done something forever or for a really long time, you have to keep doing it that way. Look around, look for, the research on the topic and independent research. Don't look at research that was authored by the company that, the product is made by. And, if you're not comfortable doing that yourself, find your infection preventionist or your, hospital epidemiologist, because they love doing that, and would be more than happy to help you with that. So I always, just encourage, make sure you're using best practice. That's, the best way to, ensure that we're providing clean and safe spaces for patients.
Fantastic. And Ben, you've got a couple, maybe 2 minutes. Impress us with some closing thoughts.
Yep. So I'll say the exact same thing as Alice. I think I talked about this a few times during the presentation, just sharing information. And I'm very glad that organizations like ISSA exist, because I think it's a great forum and a great platform to share more information and best practices. We could all be learning. I learn every single day. I think a little bit of humility and making sure you're reading up on the things and not really having, you stuck in ways that we've always done things. And this is why we're doing it. Again, I've been a part of a lot of different organizations, and some of the most toxic cultures have been, oh, so why are we doing this way? Because we've always done it that way, right? I think don't be afraid to change. Don't be afraid to do things a little bit differently. Lead with data. That's mine. Making sure you're setting aggressive goals and making sure you're doing things that are proven and backed by science. And obviously, look at, things a little bit more unbiased as far as who's actually coming up with these articles, like Alice alluded to, making sure they're not all led by industry, but a little bit more third party. I think that's important. But yeah, just sharing data openly and making sure we're all kind of elevating each other up and lifting each other up, I think is important. So that's my closing comment.
That's a good closing comment. Appreciate that. Do want to mention to everyone here today that you'll get a copy of this recording. I put that in the chat, but as part of your registration, give us a couple of days to get the recording ready. We'll send that out. Martha Schmidt's our events manager and producer, and she'll make sure that happens. So, and share this with people. Be sure to share the link to the recording with everyone on your team. It's good content. It'll help everyone with their work. And we are at exactly 1 hour. Our webinar is now over. Thank you, Ben, Jennifer, and Alice.
Thank you, Jeff.
Thank you, guys.
Thanks, everybody, for
Thanks for the time.
listening.